Good afternoon, everybody. Thank you for connecting today to the EffecTrial EffecTrial Info Day. We will begin, maybe more people will join later, but do not be delayed afterwards. First of all, I would like to present a brief context of the partnership. This is the agenda of today. It will be a welcome and introduction by myself. I'm Cristina Nieto, EffecTrial coordinator from the Instituto Carlos III from Spain. We are coordinating the EffecTrial partnership, and afterwards I will provide the floor to my colleagues Astrid Valencia and Sara Garcia, who are acting as joint call secretariat of this EffecTrial call. They will provide you more insights in this EffecTrial call, such as the general information, the aim of the call and the scope, how must be built the consortium, and the different eligibility rules. They will provide you as well explanation about the funding mechanism that applies in this call, which are the evaluation criteria and the pre-proposal template, and a very brief introduction of the submission tool and the partner search tool that we have in our partnership. Afterwards, a dedicated RRI advisor, Rob Smith, will provide you an introduction of the principles of responsible research and innovation that is a key element in this call and also in our partnership. And finally, we will have a slot for questions and answers that can be forwarded to us via the dedicated chat that is for questions and answers in the Zoom session. The EffecTrial partnership, as I mentioned before, is coordinated by our institution, Instituto of Health Carlos III from Spain. And the main specific objectives of this partnership, it began in 2022, and it fosters the European Collaborative Research Funding, creating a flexible funding body for fostering joint programming in different priority areas that will address the main European public health needs. EffecTrial as well aims to set up Europe at the forefront of science and innovation in health research by 2050. EffecTrial has 4 different specific objectives, such as supporting the relevant medical research, including clinical fields and intervention areas, to improve the utilization of existing health technologies in clinical practice, building capacity, particularly in conducting clinical studies initiated by investigators at European scale, and implementing and developing RRI in multiple ways. EffecTrial is directly related with the previous existing European initiatives, the main ERA-NETs, such as ERA-CVD in cardiovascular diseases, EuroNanomed in the nanomedicine field, and HDHL and HDHL in TIMIC in the healthy life and diet and healthy lifestyles. EffecTrial has 2 different phases. The first phase that began in November 22 has a duration about 2 years, and during this first phase we have been launching joint transnational calls in the different research priority areas of our partnership, such as nutrition, diet and healthy lifestyles, cardiovascular diseases and nanomedicine. During this first phase, we have also built a framework to support multinational investigator-initiated clinical studies. By the end of this first phase, we are launching this call, EffecTrial, which is the pilot call on clinical studies initiated by investigators, and it's a critical milestone that will allow us to enter in our second phase with the approval of the European Commission. During the second phase, that will have an expected duration of 9 years, we aim to launch as well calls in research priority areas, as described in our SRIA, also calls for multinational clinical studies initiated by investigators, and we are trying to incorporate new funders willing to fund these clinical studies during this second phase. The Consortium for Health englobes 37 partners, mainly funding organizations from 24 different countries, most of them members of the European Union, but also 3 third countries associated to Horizon Europe and 2 third countries. Our strategic research and innovation agenda that is publicly available in our website covers different high priority research areas, such as prevention and public health strategies, nutrition and lifestyle related diseases, cardiovascular diseases, and nano and advanced technologies for disease prevention, diagnostic, and therapy. We have also room for flexible funding topics, and we are in the process of updating our SRIA to cover the research areas that can be addressed by clinical studies initiated by investigators. During this first phase, as I mentioned before, we have been launching 4 joint transnational calls in different research priority areas, such as health equity, for increasing health equity through promoting healthy diets and physical activity. That was hosted the secretariat by DLR, and we funded 10 projects with 30 million euros. 30 million euros, CardioNov in the cardiovascular disease field, in which we funded 17 funded projects with 19 million euros, and was hosted the secretariat by the French National Agency, ANR. This year we have been launching 2 additional calls: NutriBrain for modulation of brain aging through nutrition and healthy lifestyle, that the secretariat was hosted by Moore, and we have funded 15 projects with 20 million euros, and NanotechMech in the nanomedicine field with ANR as secretariat, in which we were able to fund successfully 19 projects with 19 million euros. In this next year, that have been already launched some the EffecTrial call that we will present today, and also we aim to launch an additional joint transnational call in the cardiovascular field that more details will be shared soon publicly. The additional activities that we have been covering in our partnerships are the development of an early career network with the early career researchers that from our funded projects, the creation of a synergies working group with a portfolio of synergies with different European initiatives and other collaborations, communication and dissemination activities such as dedicated publications, newsletters, etc., capacity building activities such as the dedicated webinars, as you can check in our website, and also identification of barriers in translating health research into practical applications. More information can be found in our website, and we have been developing other activities, but these are the more reasonable. And we have developed as well RRI guidelines that you can encounter this description in the call test of EffecTrial and also in our previous calls, and that describe how these RRI aspects needs to be incorporated in the research projects, and it will be explained later by our RRI expert. And finally, I would like to present you that in the development of the framework for supporting these clinical studies initiated by investigators, you can find in our website the different deliverables that have been elaborated and produced during this first phase, and that can provide you important information regarding the organizations that can provide support to these multi-country clinical studies, which are the bottlenecks in designing this type of studies, which are, can be the supporting measures, etc. Thank you very much for your attention. And now I will provide the floor to my colleagues, Sara Garcia and Astrid Valencia, that will make the presentation of the EffecTrial details and will share with you all the information.
Thank you so much, Cristina, for the introduction. Good afternoon to you all. Thank you so much for your attendance. This is a very important day for us because we are launching our first call in clinical studies, so we really appreciate your interest. And let me introduce ourselves. We are Sara Garcia Rodriguez and Astrid Valencia, and we are going to to be working as call secretariat during the next year. So we are going to be the contact point among applicants, funders, and also experts. So let me, sorry. Okay, let me show you what is going to be our presentation, and it will be composed by 5 different parts. One will be the general information, the aims and the scope. Then we're going to talk about the call process and the consortium and eligibility rules. Then we are going to move to the funding mechanism, evaluation criteria and pre-proposal template. And then we are going to explain the tool for submission and also a partner search tool that is integrated in our website. Before starting my session, I would like to request you to write your comments in the specific area of questions and answers. We're going to answer them at the end of the session. But well, you can be writing them along all our presentation, so we can think about it at this moment. So we are going to start now with the general information and specifically with the official documents. First of all, well, I would like to say that the official documents are all collected in our website, so you can always go there for downloading them and also for updates. The main documents about EffecTrial are the call text, the guidelines for applicants, and also the pre-proposal template. And the submission tool is the PT outline, which is managed by one of our partners in the consortium, and it will be open tomorrow, the November 28th. So you can start, well, looking at that and also start doing your applications. But at this moment, what we recommend is to download the pre-proposal template and start working on that. And well, the 2 main dates for you as applicants will be the pre-proposal deadline, which is January 28th, and also the full proposal deadline, which will be in June 17th. Okay, well, Era for Health partnership is a co-funded one, which means that all the projects that are funded under this partnership have like a part of funding from national funding organizations, but also by the European Commission. So in this case, the projects will have a duration of 48 months. And in this call, specifically in EffecTrial, there will be 14 funding agencies from 13 participating countries. The countries that will participate are Austria, Czech Republic, France, Germany, Ireland, Israel, Italy, Latvia, Lithuania, Norway, Poland, Slovakia, and Spain. And the total available budget almost reaches 19 million euros. In this case, well, the Joint Secretariat will be hosted by the National Institute of Health. And it is very important for us to remind you at this moment that besides all the general rules that we are going to explain today in this session, which I think that are like more about general rules, where you have a series of national or regional rules, because you have to fulfill also all these criteria that are stated and were detailed in the call text in the Annex 1. So please, if you are interested in applying for EffecTrial call, go and check also the national rules that are also available in the call text. Well, and moving to the technical details of the call, I'm going to start while explaining which are the aims. And the first aim of the call is to support randomized, interventional, and pragmatic comparative effectiveness multi-country investigator-initiated clinical studies. And the second aim of the call, I think that is, well, more related to the general goal of our partnership, and is related to encourage and enable transnational collaboration between clinical public health research teams. So if you move forward in the context, you are going to find 4 specific points that are well listed there in the document. And this is very important because you need to have in mind that you need to fulfill all these 4 points in your proposals. So your proposals should be pragmatic, randomized, interventional, comparative effectiveness trials. Also need to compare the use of currently approved healthcare interventions either to each other and also between one of these and the standard of care. This also, you need to also consider in your proposal the different healthcare interventions, which can be but are not limited to, for example, diagnostic, screening, prevention, and any other treatment interventions. These kind of interventions can be also pharmacological, but non-pharmacological. It means that you can also propose some other things like surgery, like different methods, like nutrition or e-health. So the type of interventions that are addressed in this call are very open. So I think that it gives the opportunity to a lot of people to apply. But it's true that we have a limitation in the specific medical fields, or because we need your proposals to be specifically addressed to 4 specific diseases, which can be cardiovascular diseases, metabolic disorders, nutrition and lifestyle-related diseases, and also non-communicable respiratory diseases. Please have in mind that in your proposals, you can also reach more than one of these diseases and also can be related to comorbidities. So having said this, and with a picture of the aims and the main scope, well, we can say that this would be the key concepts for the applications. And what do we understand for investigator-initiated? Well, this would be clinical studies that are mainly conducted and sponsored by non-industrial organizations. Then what we mean by pragmatic? Well, this means that the studies needs to be designed to evaluate the effectiveness in real life routine practice conditions. And by comparative effectiveness, we are referring to the generation of high quality evidence that will become from the comparison of the benefits and the harms from different alternative methods. These are, well, what we consider the key concepts, but you have a series of other concepts in the call document. And I think that this will be useful to create like a frame in these cases that are not so clear. So you can always go there because these concepts are, well, the official ones, or at least come from official sources. Well, if you move forward in the context, you are going to find a set of requirements. Please do not be afraid of them, because it's true that they can seem a bit, well, too much, but it's not. Let me tell you that these are almost all like some alignments that the European Commission is promoting, or some are related to good practices in clinical research. So at the end, well, they need to be applied in the current projects. For example, I'm going to read them, briefly read them. The first one is related to the demonstration of added value of transnational clinical collaboration. The other one is related to the involvement of end users at a very early stage in your projects. This can be, well, the incorporation of patients, care providers, healthcare professionals, And well, all this aligned with the responsible research and innovation approaches. Some other requirements are more related to the data management and also with the data protection. Other requirement is the consideration of sex and gender aspects and also the gender balance in the consortia composition. One more requirement is related to the proof and track that all the principal investigators must have. And well, the consideration of the diversity of health systems across Europe. It continues, and well, it is related to the inclusiveness of patient recruitments, including underrepresented and vulnerable populations, which needs to be also taken into account with clinical and safety parameters. And then you have two more recommendations. One of these is that, well, your outcomes or the outcomes of this project, well, can be valuable for future health technology assessments. And the last one is to also consider the existing multinational networks, platforms, or existing cohorts or biobanks in your respective medical field. Well, this is related to your requirements. And then, well, I think that we have been describing all the scope, and this slide is all, I think, that complementary to what I have been mentioning, but in the opposite way. So the out of scope, this is important, but well, let me go point by point. The first one is that the studies in other medical areas different from the ones that were listed will not be eligible. Then this is very important because please be aware that those proposals or clinical trials that are focused on rare diseases, cancer, or infectious diseases are out of scope. And well, this is mainly because we don't want to overlap our activity with other initiatives from different partnerships, which are more dedicated to these areas. Observational studies will also be out of scope because it is important for us that they are interventional. Basic biomedical research or research in lower TRLs will be also out of scope. And the new healthcare interventions will be not allowed, and as well as the phase 1 and phase 2 studies and placebo randomized control trials. So, with the application of this list of requirements and this set of rules that we are asking to the proposals, what we are positive that we are going to achieve the expected impact of this call, which are mainly, well, to provide answers to highly relevant health research questions in the clinical field, to impact on public policies and the healthcare systems, to achieve or get key elements that may be helpful for the health technology assessments, and which we consider also very important is to include patients and that all the clinical research are patient-centered. So with this, I'm going to give the floor to my colleague, Sarah, who will give more information about the call process.
So the EffecTrial call is going to be developed in two phases. The first phase is the one that we are already now, the proposal submission phase, with the deadline in 28 next year. Once the submission is finished, the funding agencies will perform an eligibility check. After that, 3 scientific experts will evaluate the proposals. And in April 15th, we as Joint Core Secretariat, we communicate the results of this proposal assessment. Whether it's positive or negative, you will receive a communication. And in the positive case, an invitation for the full proposal phase. So the second phase of proposal submissions, the deadline will be in June 17, and the process will be similar in the first two steps. An eligibility check performed by the funding agencies and evaluation by 3 scientific experts. What is new in this call that they have specificities because it's the clinical studies call, is that an interview will be organized with the coordinator and the sponsor by an interview committee to check the feasibility of the study. And this will happen at the end of August, beginning of September. But after the presentation, we'll show you a summary of the calendar and the timeline. So after this interview, a review by a patient advocacy committee will be organized. The rebuttal phase will be open for the applicants, and the peer review panel meeting with scientific experts will be organized around middle September. And once the funding ranking list will be decided by the funding agencies, an ethical assessment by ethics experts will happen. Finally, at the end of October, you will receive the communication of the funding decision. Well, the coordinators will receive this communication. Okay. So it's important for you to know that monitoring of the projects will happen since the beginning. In March of each year, we as Secretariat will request from you to submit an annual scientific progress report, and at month 6, it will be required a follow-up about the recruitment with specific milestones. You have more information about these milestones in the call text. And at the end of the projects, a final scientific report will be also requested with a deadline of 2 months after the study has ended. So what you would need to know when you are going to create a consortium and to know the eligibility rules. Now I'm going to give you a summary. All this information is in the call test and the guidelines, but we thought that it's important for you to see the main ideas that you have to have in mind. So what is very important is before starting preparing this consortium is to be real sure that your organization is eligible for funding by one of the funding organizations that are participating in this call. And this information is in the Annex 1 of the call test. All the national and regional funding rules are there. So you have any doubts regarding this eligibility, the national contact persons are the people that you should contact. So about the composition of the consortium, these rules are quite similar with other joint transnational calls that we have already launched in Era for Health, and there's some peculiarities that I'm going to explain you now. A minimum of 3 and a maximum of 5 countries should be represented. The maximum number of countries can be increased to 6 or 7 if you include partners from Czech Republic or Latvia. The maximum number of the funding organization from the same country will be 2, and the same principal investigator can submit only 1 per proposal as coordinator. Partner non-eligible, it's important that you know that when a partner is not eligible, can lead to the rejection of the entire proposal. So to check this eligibility rules from the beginning is really, really important. In EffecTrial, there are two modalities of funding, either one single partner or several partners. So the first modality, if a partner is eligible, this funding organization will grant a single partner, only 1 national partner should be part of the consortium. And this partner can agree on collaboration or subcontracting format with additional recruiting sites. But if the funding agency funds several partners, In this case, the consortium can be composed by maximum 3 partners, but there will be no collaboration agreements in this case with additional recruiting sites, and every partner will be granted individually. So something that is also new in this call is that each consortium must nominate a clinical study coordinator among its partners that will be responsible during the entire process, either for the monitoring of the intellectual property rights or the internal scientific management. And it's important this coordinator cannot be a private company. Regarding collaborators, a collaborator is a non-eligible partner that has its own funds. That option is possible. And a maximum of 3 collaborators is allowed. Following these conditions, it has to prove a clear added value for a clinical study. A letter of commitment needs to be included in the proposal template. The collaborator cannot be work package leader and cannot be a recruitment site for the study, and has to secure their own funding. So this option is also a good one in some cases. Here I am showing you an example of a small consortium. You have more examples in the guideline for applicants, because we know that this new scheme sometimes can be a little bit a challenge. So this will be a case when a funding agency fund only one single partner that establishes collaboration agreements with additional national recruiting sites. So that would be one case, one example. Okay, so I thank you very much. I will come back later to explain you more details, and I give the floor to my colleague Astrid.
Well, I'm going to explain you a new funding mechanism that will be implemented here in EffecTrial. And well, I think that this part demands attention from your side, because this is kind of new regarding some other previous regular calls that you may already know. And well, I would like to mention that this kind of clinical studies will have these difficulties, because some activities can be difficult to be paid or covered by national funding agencies. So this is why the consortium, and also with the support of the Commission, well, we have developed this new funding mechanism. So one moment, please. It's not moving. Okay, no. Well, this funding mechanism mainly consists in the inclusion of one different type of costs in the cost implementation. And as you may see here, the projects will be implemented using 2 types of costs. The first of these will be the investigational costs, which will be covered by each country and the regular funding agencies. And I think that these are the costs that we normally know, which are requested to the funding organizations and by each eligible partner in the consortium. Well, these are the side costs, we can say, and normally include personnel, the clinical procedures, some services that are needed for the implementation of the project, the patient participation, and also can include some country management sites or clinical study management, but that will be developed at national level. All these kind of costs, I think that, well, also the definition and some examples can be found in the page 11 of the guidelines for applicants. And then we have one more type of costs, which is related to the cross-cutting trial management that take place for the whole consortium. So it means that there are some costs like the intervention or the study drug, as well as the trial authorization, some data collection and management. Well, some others that are related and all along the project that will have a different characteristics. They normally are developed at consortium level. This type of costs can be found in the page 14 of the guidelines for applicants, and I will explain you a bit more here, if I can. Here. Well, for better explaining this type of costs, we have included also this slide. And let me tell you that this system have been implemented to reduce some administrative burden that the coordinator or the sponsor can have if this compared to if it's paid by national agencies. So to facilitate all this multinational trial management, EFFecTrial as a partnership will offer some management services that will be performed by a crane, but this will be useful for the implementation of the projects and your normal applications. So what does it mean? That a crane or any entity that can be subcontracted by a crane, which is the European platform for clinical research, well, they will develop some tasks that will be directly covered by EFFecTrial. This is not mandatory, but this is an option just to facilitate some of your work. How this will work? Well, you need to calculate your own budget, which is mainly based on your national eligibilities. And once you have all the sum of individual budgets, you'll be allowed to calculate up to the 15% of all this amount and include this kind of management costs. So I know that this can sound, well, a bit confusing, but I think that you have all the information in the guidelines for applicants, and since it's a new method, well, we have tried to explain it as clear as possible in these documents, including also examples and providing a list of specific costs for each of them. And the only thing is that it is important for us to inform you that you'll need to request these costs in a different way. So it means that you need to calculate as a normal one, as a normal application, your costs, but there is a field in the pre-proposal template that needs to be filled, and then you need to check that you are going to request this kind of costs. So just for us to have this clear. And besides the inclusion of this amount in the pre-proposal template, you need to include this in the application platform of the PT outline. This part has been integrated in the coordinator module, but we need to let it very clear that even when it's associated within the coordinator costs, these costs are for all the consortium. So because it will cover all the general costs. So in these cases, you only need to write if you are going to apply to this kind of costs in the proposal stage. But if you pass to the full proposal phase, you will need to close collaborate with the crane to better explain all this kind of costs and how will these services will be developed. So just for you to have in mind that in those cases, well, you will need to work with them in close collaboration during the writing of the proposal. And this is just to clarify more about this. And as you can see in this chart, well, you have this box, which refers to each partner and also to the national or regional funders, which provides funds to each member of the consortium. But also you have this kind of umbrella of management costs, which are more associated to the cross-cutting ones. In this case, it will be ERA for Health, which will provide funds directly to ECRIN or one of their subcontractors, and for the implementation of those costs, which are more general to all the consortium. And for a better understanding of this method, you have one example in the page 16 of the guidelines for applicants. And in any case, please count on us for the explication of this, and you can always ask for any doubt about this.
So we hope you relax a bit. Now I'm going to explain you a summary of the evaluation criteria. If I can do it. The computer today. Oh, okay, now. So in this pre-proposal phase, there are 3 evaluation criteria, similar to the previous joint transnational goals launched in funded in ERA for Health. That is the excellence, the impact, the quality and efficiency of implementation. And in the full proposal phase, there are 2 new criteria fitted for the clinical studies that are the competence of the research team and quality of research environment, and the methods and design of the clinical trial. What is important for you to know that the consortium will not be funded if the sponsor does not present the capacity to implement the clinical study. This is also new in this call, independently of the scientific quality of his proposal. So this is something important for you to know. Regarding the proposal template, I'm not going to enter into detail, but we think it's important that you take in mind some tips when you are filling all this information in the submission tool and after the PDF that is generated. It's important that you follow the format rules of type and size of fonts and the maximum number of pages. Make sure that the pages are numbered. Only one single PDF document should be uploaded into the electronic submission system by the coordinator in English. And incomplete proposals or proposals using a different format with missing signatures or not respecting the length limitations can be rejected without further review. And also, it's important for you to know that if there is inconsistency between the information register in the electronic submission tool and the PDF, the information register in the submission tool will prevail in this case. And at the beginning of the proposal template, in the first pages, you have a checklist for the coordinator that is, we think is very useful for you to tick all the sections once you start advancing in all this administrative process. First of all is this eligibility of the project partners. Be really sure that they check this eligibility to receive funding. All partners should sign the proposal application and declare that they do not receive funding from other public funding. And in addition, also the collaborators have to sign this proposal application form. And there's a special mention for applicants applying for funding from Germany, that they are only eligible if in the scientific approach they use at least one nutrition or lifestyle intervention. You have more details about this in the Annex 1, about all these general conditions that you should follow. So yeah, my colleague Astrid is going to explain you now about the submission tool.
Let's continue, and we are almost finishing our session and the information we have prepared for you. I'm going to briefly explain about the submission tool. As I mentioned, it needs to be all your information of the proposal needs to be uploaded in the PT outline, which is the platform that we use. And it will be open tomorrow. So please, if you can at least give it a look, just to have a better idea on the modules that we request. And for the submission, only the coordinator needs to create an account, and he or she will be the one that will upload the template and also the information for of all the rest of partners and the recruiting sites, and also for the sponsor. So this is a common mistake that some applicants do in this type of projects, that they do not upload the correct information or the whole set of information that we request. So do not wait until the last moment to go and check the PT outline, please, because, well, it is true that it's not so complicated, but you will need to collect some information from your partners in advance. So it will be mainly to have the information on your organizations, the address, some administrative info, and then you'll need to upload also the pre-proposal template. Here is the link to the application platform. And, well, just a reminder, the deadline for the pre-proposal, which will be on January 28th. You will need to create an account there, and then you'll be able to present your proposal. If any doubt on this, well, we can always help you. And then we would like to present a partner search tool that is integrated in the website of Era for Health. And it is helpful for you to find some partners for the creation of your consortia. If you go to the website of Era for Health, you will find that in the funding opportunities option, you will find partner search. Well, there is a description there on how this works. And at the end of the link, well, you can find a different one, which takes you out of the Era for Health website to an additional one, to a new window. And there you can filter by the program. In this case, well, you will need to select the EffecTrial call, and you will have there the expressions of interest. So please, if you have interest in that, I think that this is a good place to create your expressions of interest. It's useful also for the presentation of your ideas and your names and general information, but also now it's been newly integrated, this chat option, which, well, you can go to a certain announcement, and then you click there, and you have the possibility to contact through a message with the one that created that announcement, and so you can start, well, developing your consortium. And I don't know if I have any more info about this. I think that this is all from my side. Yeah. And, well, yes, I will close our presentation by giving you an overview of which will be the main dates under this call. There are some other dates that are important, but they are more in terms of internal assessment or internal tasks. But for you as applicant, well, this is the list of the main steps or points that can be useful in the calendar. In November 20th, it was published the call documents in our website. Today, we are now developing the webinar info day. So the next important date will be the deadline for the proposal submission. Please have in mind that it will be on January 28th. And the results of this evaluation will be in April. So you are going to be communicated to that you passed to the next phase or that the proposal failed. And well, then in June you will have the new deadline for the full proposal submission, which is June 17. And in September, it is important because the last week of August and the 1st of September, it will take place, the rebuttal stage and also the interview. So this is important for all the applicants to have this very clear, because we know that these are a bit hard dates, because some of us are on summer vacations and that, but you are going to be contacted because these steps will take place and we cannot delay them. And in October, at the end of October, we will communicate the decision on the projects that have been selected for funding. The projects that are funded are expected to start in between January and May of the 26th. And that is all for our side. We understand that this is a lot of information. Please, I think that you can, if you have any doubt, you can, in a first step, consult the call documents, in which we have tried to summarize all the relevant information in the call, and we have provided some examples and detailed information for a better understanding, because we know that that we have included some new processes, but if not, we provide a specific email for you to contact us, and also you can call us by phone and we will try to give you support and clarify any doubt. And that is all for our side. Now we are going to move to the part of the research, of responsible research and innovation. Okay, so I give you the floor. Thank you so much for joining us here in the presentation of this call.
So thanks for having me. So I'm a lecturer in science and technology studies at the University of Edinburgh. I'm actually not one of the program administrators, but an academic, and I've been working as part of a group with ERA for Health funders to think about how to embed responsible research and innovation into the programs, which is one of the overarching goals of the program. So I'm going to just run through some introductory slides to RRI and what we might be thinking about here, and then give you a little bit of information about what it might look like in practice. And I think the most important thing to say is that almost everything I'm going to say there is a document in the call guidelines, and also guidelines for responsible research and innovation, which has been developed by the program. So if in doubt, please do just refer to those. So why responsible research and innovation? And I think the easiest answer to this is that the idea that health is more than a medical matter. So there's lots of examples now and understandings now of the way in which health and the social come together and interact in different ways. So that might be through understandings of the social determinants of health. It might be around ideas around stigmatization of particular diseases, around our categorization of them. Very obviously in this kind of context, it's about, we have a kind of great deal of knowledge now about the kind of the clinical context that many treatments and interventions are used in. These are social settings, and are increasingly around ideas around public involvement, patient empowerment, that are important in the design of these studies. There are social assumptions embedded in lots of medical knowledge and lots of medical technologies. Some of these might seem kind of outdated and outmoded now. We might think about the role of race in medicine, but there are similar kinds of perhaps less questionable assumptions, but the assumptions still the same in current knowledge. And as the final point, I suppose, is that of course health and medical knowledge needs to be used in informed policy, and a key goal of these trials is for the knowledge that they produce to actually shape decision making, and this is of course a social dimension. So responsible research and innovation is really a framework to begin to get at these broader dimensions of health and medical knowledge and technologies. It's a specific framework. It's one amongst many different frameworks, but it's the one that the program is committed to. And so just to give you a sense of what this might look like in practice, I work primarily on the politics of synthetic biology, and so one technology that people have been talking about a lot is the idea of a synthetic biology biosensor that would be used to address arsenicosis in Nepal. It's a really important, clear unmet clinical need or unmet medical need, really important technology, but there's a whole range of considerations to think about. So who is going to use this technology and how are they actually going to use it? Is it usable for them? Does it actually solve a problem? So is it just about sensing, or does it solve the actual problem of arsenicosis? Has this knowledge shaped the design of the technology? What happens after it's used? So at the end of life, is it just thrown on a rubbish dump? Is it recyclable? How does it compare to alternatives? So there are obviously lots of different ways of monitoring things like arsenic in water. Why use this technology? How is it going to be regulated? And what else might happen as a result of this? What might be the unexpected consequences? So responsible innovation is really about making space for these kinds of considerations to be thought about throughout the research and innovation process. So rather than just dealing with them at the end, thinking about questions that people and organizations like health technology assessors will be asking those questions earlier on. So in the context of this call, what we're going to be looking for is the applicants are showing how they're going to generate that kind of social, ethical, economic knowledge, and how it will play a role in the design and the conduct of the studies. I'm not going to say too much about ERA for Health's interpretation of RRI because, again, this is in the call guidelines and it's also in the guidelines for responsible research and innovation. But in general, it's steered by 4 dimensions. So a dimension of anticipation, of inclusion, of reflexivity, and of responsiveness. So anticipation is about asking what kinds of potential consequences might come from these interventions, trials, technologies, and who might benefit from them. Inclusion is about asking who gets to decide and whose knowledge plays a role in these studies. So the most obvious connection here would be to patient, public and patient inclusion and participation, but you might also think more broadly about other stakeholders. Reflexivity is about making sure that you're questioning knowledge gaps and assumptions. So are there things that maybe that we take for granted, that if we paid more attention to them, it would improve the quality of the work that we do. And responsiveness is a reminder to make sure that you design studies and projects that have specific points in them to actually take this kind of knowledge seriously and integrate it into the decision making. So these are 4-year projects. There should be, in principle, several points throughout those projects where your broader social ethical knowledge can shape decision making within them. That might be at meetings, it might be in particular stage gates of the trials, it might be an advisory board groups, but there should be kind of ways of embedding that in decision making. So in the application, you're going to be asked a series of questions. There's 4 questions. The approach that we've taken is quite broad. because we're really interested in knowing what you come up with. This is the first time this has been done for clinical studies, so we're trying to be quite inclusive and expansive to begin with, and then we'll begin to narrow things down and be more specific in future calls. So you're going to be asked for an overview, so of the approach you're taking. We'd like you to do a brief assessment of what you think the most relevant social, political, equity, cultural dimensions of the work might be. There are frameworks in the guidelines you can use to help do that. And we'd like you to explain how you've designed the project to embed consideration of these issues, and importantly, what kind of resources and person time you're going to put towards it. We'd like you to talk about stakeholders. So there's a subsection where we'd like you to talk about the role and contribution of operational stakeholders. So the most obvious groups here are obviously patient advocacy groups, but you should also be thinking about caregivers, healthcare providers, and please try and be as specific as you can for these, because we can list these general categories, but of course when you get to specific interventions or studies, they're going to be much more tailored, and they're also going to be locally kind of specific, ideally. In this section, describe the level of involvement and how they're going to shape decision making if that's possible. In recent years, there's been, I think, a normalization of the idea of PPI, which is great, but a lot of it still ends up being quite one-way kind of outreach or dissemination kind of models. We're interested in that has a place, but we're interested in seeing if we can move towards a kind of patient empowerment model, so that begins to involve relevant people in the co-design of the projects, and also gives power to people to shape decision making. It's not mandatory. You can justify why you're not taking this approach if you feel as though it's not appropriate. We know it's not for all projects, but if you can, it would be great to hear how and why you're doing that. So yeah, what I just said applies also to the role of patient involvement and patient participation. So that's part of the groups, and then the final section is just a question, a yes/no question with a slight opportunity for elaboration. So the question is just, do you comply with ethical principles? The right answer is obviously yes, but you need to explain a little bit how you're doing that. So again, responsible research and innovation will be part of the evaluation criteria. Explicitly at the pre-proposal stage, it's mentioned in the impact section, but I do just want to flag that there are several other dimensions that several other aspects that kind of point to it being implicit. So responsible research and innovation relates to things like the unmet clinical need, the efficacy of the interventions that you're thinking about, the impact on patient benefit, clinical practice in the healthcare system, and the involvement of patients and stakeholders. So all of these dimensions are relevant things, and so ideally a really good project that has embedded RI into its decision making will also be doing really well on these kinds of dimensions as well. It obviously is also, if you're doing a really good job, then this is something that will be embedded within the operationalization of the study, so it relates here as well. So how should you approach these kinds of questions? So the first thing to say is that this is an experiment. This is the first time that we know of that a program has tried to embed responsible research and innovation explicitly in investigator-initiated clinical studies. So we know there are lots of rules and constraints around these programs, and we want to see what you come up with. That's why the approach that we've taken is to be quite open, and then we'll provide guidance and feedback, I think, after this first round about what we thought about these kinds of approaches. And again, so I just want to emphasize that although this is a European program, we also know that the funding landscape, so what individual funders can cover, the kind of budgets that you have available, and the context that you're working in are diverse. So again, we will accommodate that diversity in the evaluation. And the third point to make is that this is the section in the proposal is a standalone section. So you'll see it says in the pre-proposal, it's got a 1.5 page limit on it. And it has these discrete sections. But this work will be much easier for you to complete and show that you're doing a good job of if you can do these three things. So if the work that you're describing in that section is actually embedded in the work plan of the project, if there's person time dedicated to it and there are outputs, and if there's relevant expertise in the consortium. So there are a couple of questions about whether it's mandatory or strongly recommended to include expertise like health technology assessment or medical sociology in the consortium. I mean, the answer is it's not mandatory, but if this kind of expertise is present and visible, it will make the responsible research and innovation work far easier to demonstrate that you're doing well. So in practice, this is going to be disappointing for some people, but there is no single answer to the way that this work should be done in practice. It needs to be specific and tailored to the projects that you're developing. The guidelines that we've put together do have several examples of things that you might pursue or approaches you might take. In general, try and treat ROI as in the same way that you would treat the kind of scientific parts of the proposal. So that means find the right people as quickly as possible, include them in the design of the project from the outset. Think about the best organizational model. There are lots of different ways of doing this work. So it could be specific research, it could be a HTA work package, it could be in the form of advisory boards or stakeholder collaborations and partners. But try and make that specific to the project in the way that you would do with any other part of it. I can't really emphasize enough that make it someone's job. That could be the coordinator or it could be a specific expert, but I think if someone has responsibility for making sure this work happens, it often looks better to the reviewers and is easier to see what the kind of outputs might be and how it will be connected to the work of the project. Penultimate point, obviously this is a competition and there's a kind of an economy around this about trying to promise that your work is going to be kind of very transformative or kind of really significant. And we want you to do that. But when we're talking about ROI, one of the aspects that is important is that we're kind of comfortable with that ambiguity. So part of the goal of ROI is about trying to get at some of the complexity and the uncertainty associated with doing health research. So if you want to express this kind of uncertainty and ambiguity in your ROI sections and say that you're going to investigate that, that's completely fine. The panel will often reward that more than not, to be honest. It has done in the past. Obviously can't speak for specific panels in the future, but in general, this kind of approach is something which fits the kind of ethos of ROI. And then finally, just a lot of people end up focusing on things like dissemination and safety and patient acceptance when they talk about ROI. These dimensions are important, clearly, but they're not all that's important. So when you're thinking about ROI, please think more broadly about the kinds of issues that might be relevant. That might be around data use and management. It might be around, not about patient acceptance, but about patient empowerment. It might be around the use of a technology and generating that kind of knowledge. There are lots of different dimensions beyond these three things that are common. And with that, I think I'll stop. So thank you. I'm happy to take questions, and yeah, please get in touch with the call officers if you have any specific questions around ROI.
Thank you very much, Rob, for the presentation. Hope that everything is clear for the applicants. They can only ask questions through the question and answers chat, so there's not a possibility for them to open ask. We will begin with the questions that you have been forwarding and trying to reply all of them as if possible. Nevertheless, there will be a dedicated document in the website with the questions and answers by written of this webinar, and potentially other questions that we could receive afterwards and that could be relevant for everybody. We will try to begin to answer the questions. First, let me also introduce some of the speakers that were invited today to this webinar, to this Info Day, especially Albert Barbera, our Vice Chair from the Strategic Advisory Board of ERA for Health. Albert, I don't know if you can say some words. Well, he's connected in the webinar, and also Alberto Borovia, who is an expert from the Spanish node of ECRIN. In case that there are some technical questions that we could not answer, they could try to provide an answer. Nevertheless, please be aware that especially those questions regarding the scope of the call, the final decision if a proposal is in the scope of the call or out of the scope will be the decision of the evaluators that will review the pre-proposal submitted, not directly us. That's an important fact. So we will begin to read the questions. The first one is, if a trial is already funded by a national funding organization in Germany, will be eligible for an EffecTrial application to add Israel as a center. Regarding this question, we lacked information, but just to precise, normally double funding is not allowed by the funding organization of the same topic of the same research question that is already funded at national level by a funding organization. If it's a new development of or the continuation of a clinical study that is already running, but it's differently the type of questions that will be in the application, the funding organizations need to check their eligibility of the cost of this cost. But normally double funding is not allowed. This is the important fact. The second question would be, I would like to know if the proposal we submitted last year won. Can we submit a proposal on a different topic this year? Thank you. Regarding this, I assume that the proposal is in an ERA for Health previous call. There is not a clear incompatibility of funded projects in the previous joint transnational calls of ERA for Health and this call. There is not a clear incompatibility in the call test. Nevertheless, some of the funding organizations may restrict participation of a previous awarded PI. So in this case, you need to check exactly the national regulation of each funding organization that you are requesting the funds, just in case that they have an additional incompatibility for the PIs that have been awarded already for funding, not only in ERA for Health calls, but in other calls at international level or national level. This depends on each funding organization. But at central level, there is not an exclusion of the funded already projects in the joint transnational calls of ERA for Health. The next question is the topic kidney transplantation considered a rare enough disease, or is it within a scope? Regarding this, the rare diseases definition is provided by WHO, the World Health Organization, and also under the European Commission there is a specific definition of rare diseases. So you need to check if the specific disease that you are having in the research is or not a rare diseases, because there is a clear definition there. Additionally, for being able to apply to this call, you need to be within the research priority areas that are mentioned in the call text. So either a metabolic disorder, cardiovascular diseases, etc. So if it's not in the 4 main priority areas, mark this clinical research would not be also in the scope of the call. So you need to reflect to that. The next question is it possible to apply from countries not in the consortium list? The partners that can apply for funds, that can request funds, are only those that are within the participating countries of the call, from the funding organizations that are specifically mentioned in the call test. Nevertheless, there is the possibility for adding 3 collaborators maximum to each consortia from other countries, can be. So in this case, they could participate, but as a collaborator.
Cristina, can I say something about this? Well, I think that regarding the collaborator, this is important to know that only 3 collaborators can be integrated in the consortium. They will be participating as self-funded, but these kind of questions are important for us also because this is our first clinical study call. So I think that, well, we can transfer this information also to other funders that may be acting as funder in the future. So I don't know, this is only one thing that I would like to highlight because it's important also for us to know your interest as at the level of the partnership.
Yes, sure. As Astrid mentioned, in the future ERA for Health calls, we expect that more countries are involved as participating funding organizations. So hopefully your country will be on board, but we kindly request you to transmit your interest in this call to the funding organizations that are funding this type of research in your country. Since as we are beginning our second phase in the next year, we will be more than welcome to have new funding organizations on board of our consortia if it can help to participate your country in this type of calls. So we continue with the next question. What does the requirement of approved healthcare interventions relate to interventions such as lifestyle modification that are not subject to formal approval? In this case, what we are considering are those interventions that are already as a standard of care, that are implemented in the clinical practice already, that are not new interventions. Canco PI in NutriBrain 24 submit an application is what we answered before, that there is not a specific restriction. Is that possible to involve partners in other countries? Well, this will be the same as collaborators if they are not included in the participating countries that can request funds. This is the same. Then the call emphasizes patient-centered decision-making. Could you elaborate on the types of patient engagement strategies that will be most impactful for this call? For instance, as involving patient association as partners is sufficient, or is a deeper level of engagement expected? Already is explained in the call test how the patient associations can participate, and also Rob explained before how can this patient involvement can be pursued. Be aware that some of the funding organizations cannot fund directly patient associations, so sometimes to include as a partner in the consortium a patient association is not so easy requesting funds, but they can always participate as collaborators, as subcontractors of the main partners if the national eligibility allows this option, or including them in the patient in an advisory board. The most important is that they are included from the beginning of the clinical research, from the design of the project, that they are clearly involved, not only as patient recruited, but that they are involved in the definition of the research question, etc. And that this is explained. This is important because sometimes it's not clearly explained in the proposal. So this be aware that the full proposals will be reviewed by a patient representative and this person will clearly focus their review in these aspects. So it's very important that this is clearly incorporated in the application, but also explain clearly how they are involved. Relevance of nanomedicine. While the goal is technology agnostic, how will be interventions like nanodelivery systems for cardiovascular or respiratory diseases be assessed? Will be the inclusion of innovative delivery mechanism count as added value, or will be considered a new healthcare intervention out of scope? Here, we need to be within the scope of the call. Nanomedicine is not excluded, but it must be approved healthcare interventions and not new health interventions that are developed. That this will be out of scope, the development of new interventions. But if they are already approved interventions and they are compared one to another or within the standard of care, this could be a comparative effectiveness trial if it's within the scope. Repurposing existing drugs. Could innovative repurposing of drugs through nanotechnology notably be considered aligned with the scope if it directly addresses eligible medical condition? Well, as I mentioned before, if it's a new indication, that will be a new intervention, this will not be within the scope of the call. It needs to be an approved already in the healthcare intervention.
Sorry, Cristina, just to add, I think that while there are some questions which are also very, very technical, and I think that we will need to go very deep into the details, so it's not so easy to answer at this moment, and also because we are more in the management area than in the technical field. So just to clarify that in some cases we will need to check this more in depth. So you can send us your questions or doubts through an email, and it will be better analyzed.
Thank you. The next call is regarding the collaborative added value. The call requires demonstrating added value through transnational collaboration. What specific examples of added value are encouraged beyond multi-country involvement itself? It is all about better patient recruitment. It's not only the patient recruitment, which is an added value of the multinational clinical trials compared to the ones performed at national level, but it's also that they are a consortium that is complementarity in their expertise, that the different partners from the different countries can establish a true transnational collaboration, and this can increase the quality of the research consortia, because maybe there are expertise that are not encountered all of them in one specific partner of one country. So this will be the added value, apart from the added value that multinational clinical studies has regarding the patient recruitment. Regarding the green support, can we instead choose some other management support company or organization and apply up to the 15% of our cost for this? This is very well explained in the guideline for applicants document. I will encourage you to read this section in detail, but in this case, the additional management cost can only be requested if if you choose to either collaborate with a CRIN because they can offer you directly those services, or in case that they cannot offer them, but in that case only, they could subcontract another entity for performing these services. But this needs to be established together with the CRIN. You cannot request directly for this additional budget and not collaborate with the CRIN, since this budget will not be forward to the partners of the consortia. It will be forward to a CRIN, or a CRIN will subcontract another entity, because this is a budget that comes from the Era for Health partnership, not from the funding organization at national or regional level. But this is plain, and there is an example in the guideline of applicants of this additional budget. Could you clarify the specific activities that the CRIN will undertake? And this is the same, in the guidelines for applicants is described which are the cross-cutting trial management activities that the CRIN can perform, and normally they are sponsors delegate tasks that are within the responsibility of the sponsor, but that they can be provided by a service provider. And those cross-cutting trial management costs can be regarding the trial authorization, the data collection and management, statistical analysis, safety, study design, and protocol development, and other overall management activities. But just to precise that for those proposals that go under the second phase, under full proposal phase, CRIN will collaborate closely with all of these applicants to establish exactly in detail how this additional budget can be distributed. In the pre-proposal phase, you need to specify that you will request this additional budget, but without entering so much into detail. And then in the full proposal phase, you will need to describe exactly how this distribution of the budget, but the CRIN will support this. Sorry. Should the clinical study coordinator that needs to be nominated be fully employed through the project budget? Here could depend on your national and regional regulation of the funding organizations that is funding the coordinator. No, for us at least, the PI needs to be belonging to the beneficiary entity, but not cover their personal costs with the project budget. But this could depend on each funding organization. So you need to consult specifically this to your national contact point of the funding organization that you are applying for.
Yes, this is the case for EASY in Spain, but some other funding agencies can have different rules. So you need to check with them.
Yeah. Will it be advisable to include an HTA expert in the consortium? Regarding this question, in the call test, in the expected impact is addressed that especially those health interventions that are compared with the standard of care can have a health technology assessment impact. Therefore, it will be suitable in case that this is the case that you can provide this added value for health technology assessment to have this expertise in the consortium. Maybe it's not needed to have a dedicated partner as a health technology assessment expert. Maybe it can be in the advisory board, etc., or an expert in the team of one of the partners. But it will be suitable to have this expertise, especially for those proposals that can clearly make recommendations, etc., in this sense. Can I check if I understand this correctly? If requesting cross-cutting trial management cost, this will come from ERA for Health's budget and not from the consortium's budget through the eligible amount. Though the eligible amount will be calculated based on the total requested. Yes, the additional budget for management cost is calculated as the 15% of the requested budget to the funding organizations. But this additional budget does not belong to the one that is requested to the funding organization. It's an additional budget that is provided by ERA for Health.
So yes, it is well understood.
Yes. Including a dedicated budget for a CRIN or subcontractor is the result of a thoughtful reflection by ERA for Health management, drawing on lessons learned from other clinical studies initiated by investigators globally. Could you explain a bit more the rationale behind this new scheme? What is the main goal and how does it aim to enhance the success and efficiency of funded projects? Yes, this is indeed a new funding scheme for multinational clinical studies that have been developed by ERA4Health after months of reflecting on the different models and funding mechanism that other European initiatives and other international initiatives and partnerships are applying in different medical fields. And after reflecting all of this and also consulting the European Commission to check what it was feasible for ERA4Health to be implemented in this call, we have developed this new funding scheme. And the advantages to use this additional budget are that especially that there is a flexibility in the budget that is allocated in the consortium, because normally the funding organizations have restrictions to allow cross-border funding. Therefore, this budget that comes directly from the ERA4Health partnership through ECRIN, which is one of the partners in our consortia, provides the funded project, the flexibility to have this cross-border funding on these activities, because normally the cross-cutting trial management activities are performed by an entity, by a partner or a service provider, but on behalf of the whole research consortia on the different countries that are represented. Can the collaborator partner be an academic institution from a country that is not part of the call? As a collaborator, they are participating with their own funds, so it will be possible in principle if it's covering the expertise required for the consortium and the clinical study. There it can be different types of partners as collaborators, I mean. Different types of entities, I have to say, sorry. They can be patient organizations, academic institutions, etc., because they are not fulfilling the national and regional regulations of the funding organizations. They are on their own funds. How does the requirement that the healthcare interventions be approved relate to interventions like, I think that we already replied this question before. Not sure if it's repeated. Is there a limit to the number of proposals that will go to the stage 2, or do all proposals that score above a certain threshold advance? Here, it's not only the evaluation threshold that we will take into account, but also the availability of funding. So therefore, there is not not all the proposals above a certain threshold will go to the second phase. This is more complex, the decision, and is taken by the clinical steering committee that conforms all the funding organizations participating in the call, because we need to define other criteria, not only the threshold of the evaluation, but also the availability of funds. And also the feasibility to go under the full proposal evaluation, because it's more complex and we cannot have a very high number of full proposals for the second stage. But it's not predefined directly before. Will all applicants that make it to full proposal be invited to interview? Yes, all full proposals applicants will be invited to the interview. This is a mandatory step in the evaluation of the full proposals, and it will be online, which is the next question. The interview will be online. I think maybe we can
only one thing, that these interviews will be like more dedicated to analyze the operational feasibility.
Yeah. Mm-hmm.
So and you can also find more detailed information there in the call documents.
Mm-hmm. We can continue some more minutes to try to answer a little bit more the questions, and if there is not enough time, maybe after by written we can answer all of them. Sorry. Flexibility for consortium adjustment. Well, regarding this, there is another one that is also afterwards related to this. It's specified in the call test that the changes between the pre-proposal and full proposal cannot be substantially, and if there is a very important change between the pre-proposal and the full proposal, it needs to be clearly specified, which could be the replacement of a partner, the change of a partner between pre-proposal and full proposal is not the desirable, because it has already been an evaluation, and so it will affect the previous evaluation. But in case that it will need to be adjusted, this needs to be reflected, and it will be evaluated in the full proposal phase. But needs to be communicated to the Secretariat and approved by the clinical steering committee before going to the second phase. Will it be acceptable to have a partner that is solely focused on RRI with a specialized expertise, does that not participate as a site for the clinical study? You need to check this. You need to check if this partner on RRI first can be participated requesting funds, because sometimes it's not within the eligibility of the funding organizations, and afterwards you need to think if the consortia can have this partner on RRI issues specialized only in this and not be a recruiting site. Depending on the project, it can be feasible, but we cannot answer directly that. No, the duration of the studies, the initial duration is 48 months. Is the next question, if the duration of the study can be less than 48 months. No, it needs to be the initial duration 48 months. Can an assistant professor doctor apply as coordinator? This will depend on the national regulation of the funding organization. Can a randomized controlled trial project of implementation of the diabetic food prevention protocol be presented at the regional level? This, we need to consult I don't understand the regional level. If it's for focus on one of the regional funding organization, and we will need to know exactly what is about, to know if it's in the scope or not.
For this call, almost all the funders can fund the different types of medical areas. Just to clarify, because I don't know if it's related with this question. Only in the case of Germany, they are only dedicated to nutrition projects, but for the rest, I think that this is possible. But in any case, I don't know if we are understanding this question completely fine.
Is a consortium with other countries compulsory? The minimum of countries represented in the consortium is three countries minimum represented, but it's all specified in the context in the consortium composition section. Does it have exclusivity, or can other funding be requested during the process? I think this is a national question. Maybe it's better that you consult directly your funding organization for national regulations.
But is this about the consortium?
No, it's regarding the national regulation. Is there if there is a clinical study has already been completed on a national level, will it be appropriate to apply to do a new study on an international level? This is similar to what we replied in the beginning. If it's within the scope, if it's not having double funding, if it has been finalized and then it's a new project, a new study that is within the scope, in principle it will be eligible for funding, but you need to consult specifically your funding organizations to know if there is any incompatibility of the PIs, for example, that can apply for funds, etc. And the rest, I think that we... regarding budget, what are the in-kind contribution of different partners? The in-kind contribution are the funds that are provided on their own. For example, for personnel costs, if you are providing personnel costs that are not covered directly by the project, for example, if the PI is not having their own personal costs covered by the project, this will be in-kind contribution to the project. But it's specified. Also, if you have infrastructures that your entity will provide in kind without requesting funds in the project, this will be also in kind contributions. So, how does a site join the Pathfinder platform for feasibility to other potential partners? I don't know if you can reply this one.
Well, you can create your own profiles and your own announcements in the Pathfinder, and you can share the link to the tool. But I don't know if I'm quite understanding this. Well, in cases that you know any platform or any network that can be interested, you can share the link to your announcement, but they need to create a profile for them to see it. So. Well, you will need to share more information with them, but I think that this is a good way to express your interest and define a bit more about your ideas.
They can also interact with expression of interest that are already created in the Pathfinder. They can also send a message to contact directly those potential applicants in case that you want to conform the consortia. And which kind of organizations can participate? Enterprises are excluded, but can NGO coordinate a project, for instance? This will depend also in the national regulations of its funding organization. They are explicitly mentioned which are the eligible institutions for its funding organization. So normally they are more on the public health services, hospitals, etc., or academic institutions. But if you have any specific questions, you need to go directly to each funding organization and consult, which is feasible. So thanks a lot for joining today. In case that we will try also to provide in written the answer to these questions, maybe to concentrate some of them if they are similar, and they will be published in the website. If you have any further questions, you have the EffecTrial email, the contact details for the secretariat, and all the contact details for its national contact point. Please, for the national regulation, contact directly your national contact point from the funding organization that you plan to request the funds. After reading carefully the annex in the goal test that they are defined, they are the different details. We encourage all of you to participate in the EffecTrial call. We are glad that this pilot call has been launched, and hopefully that is a successful call for all of you. And please don't hesitate to come back to us if you have any potential doubt or you need further information. Thank you.
Thank you so much for joining today.